Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Screening for colorectal cancer. Introduction. Cancer of the colon or rectum is called colorectal cancer. It is one of the most common cancers among men and women. Colorectal cancer kills more people each year than breast cancer or prostate cancer. The earlier colorectal cancer is found, the better healthcare providers can treat it. This program provides information about colorectal cancer. It will help you understand the two screening tests most often used to find colorectal cancer early. You will learn about the advantages and disadvantages and the possible risks and complications of these two screening tests. The colon. When you eat, food goes into your stomach. When food is digested, it goes from your stomach to your small intestine and then to your colon. In the colon, stools are formed from leftover food that your body can't use. Stools are stored in the last part of the colon before leaving your body through the rectum. Polyps and cancer in the colon usually grow slowly. A polyp is a mass of tissue that grows inside the colon. It looks like a small grape. Polyps may bleed from time to time. Sometimes this blood is visible in a person's stool. Some polyps can turn into cancer over time if not removed early. Not all polyps grow to be cancer, but they should be watched closely. Screening. Healthcare providers recommend that all people age 50 and older get screened for colorectal cancer. Some people may need to be screened earlier because they may be more likely to get colorectal cancer. For example, sometimes colorectal cancer runs in families, so if someone in your family has had colorectal cancer, you may want to be screened earlier. Healthcare providers may recommend early screening if you are African American, because African Americans sometimes get this type of cancer at a younger age than other people. Screening tests can point out warning signs before you notice that something is wrong. The two tests healthcare providers suggest most often are colonoscopy and a fecal occult blood test, or FOBT. A colonoscopy is a procedure that allows a healthcare provider to look inside the colon and find polyps before they bleed or become cancer. It can also find cancer in its early stages. A colonoscopy is the only test that allows your healthcare provider to look directly at the inside of your entire colon and take polyps out or biopsies of abnormal tissue if needed. Blood in your stool can sometimes be found by a screening test like FOBT, which may give a warning sign that you could have colorectal cancer. Fecal means stool and occult means not seen by the naked eye. Therefore, a fecal occult blood test, or FOBT, detects blood in your stool that you can't see. If an FOBT detects blood, this does not necessarily mean that you have colorectal cancer. Many other conditions can cause blood in the stool. If the test finds blood, your healthcare provider will order other tests to diagnose the cause of the bleeding. These next sections explain colonoscopy and FOBT in more detail.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Colonoscopy. Healthcare providers recommend that you have a colonoscopy once every 10 years after age 50. You may have them more often if your healthcare provider finds something that needs to be checked regularly. Before you have a colonoscopy, your colon needs to be clean. You will be given a strong laxative to help clear your colon. Your healthcare provider may ask you to drink only clear liquids for 1 or 2 days to clean out your colon. A colonoscopy is done as a same-day or outpatient procedure. The procedure only takes about 15 to 20 minutes. You will get medicine to relax and sedate you. You will be sleepy and should not have pain. Your healthcare provider puts a small, flexible tube called a scope inside the colon through the rectum. The scope is attached to a camera that projects pictures of the inside of the colon on a video screen. When the scope goes into your rectum, you may feel the need to have a bowel movement. Let your healthcare provider know if you feel this. You may need more medicine to relax you. The scope will be used to look at your entire colon. If your healthcare provider finds a polyp or other abnormality, he or she may remove it and send it to a lab to check for cancer. At the end of the procedure, your healthcare provider takes the scope out. A colonoscopy is usually not painful, but you may experience some discomfort. You will need someone to drive you home after the procedure. You will also need to take the rest of the day off while the effects of the sedation medicine wear off. A colonoscopy is a safe procedure that could be life-saving, but it has possible risks. Sometimes the colon is not as clean as it needs to be. If this happens, you might need to have the test another day when your colon is cleaner. If a polyp or other tissue is taken out, you could have some bleeding from the rectum. There is usually not much bleeding. If you have a lot of bleeding, call your healthcare provider. A rare injury is that the scope could hurt the inside of the colon or even make a small hole in it. If this happens, an operation might be needed to fix the injury. The FOBT. Healthcare providers recommend that you have an FOBT, or a fecal occult blood test, once every year after age 50. Even though the FOBT is not as good as a colonoscopy at finding polyps or early cancer, some patients prefer it. You should watch what you eat before having an FOBT. Some foods can make the FOBT give incorrect results. To avoid this problem, do not eat the following foods for 2 to 3 days before the test: turnips, beets, radishes, horseradish, artichokes. You should also avoid the following foods before the test: mushrooms, broccoli, cauliflower, and bean sprouts, apples, oranges, and bananas, grapes, melon. The blood in red meat can also make the test inaccurate. Do not eat red meat for 2 to 3 days before the test. Do not take iron supplements, aspirin, or vitamin C before the test, because they can also affect the results. Your healthcare provider may ask you to stop taking some medicines that could affect the FOBT results. Ask your healthcare provider about what not to take before you have the test. If you have your menstrual period or have bleeding hemorrhoids, the FOBT should be done at another time. To be most accurate, the test should be done at home over several days. A small sample of stool is placed on a test card. Follow the instructions carefully. For most tests, you will use stool samples from 3 bowel movements on 3 different days. For 2 to 3 days before each test, remember not to eat foods or take medicines that could indicate that you have blood in your stool when you really don't. Although you may find it unpleasant to collect a stool sample, the test has no risks and is a good way to screen for cancer. Things people use to clean or deodorize toilets may affect the test. If the stool sample card touches any part of the toilet or another place where cleaning products were used, you should redo the test. If your FOBT shows blood in your stool, your healthcare provider may ask you to repeat the FOBT. You may also be asked to have a colonoscopy. Blood in your stool does not necessarily mean that you have cancer. Remember that many foods and medicines can affect the results. Most people who do have blood in the stool have other health problems, such as bleeding gums, ulcers, or hemorrhoids, not cancer.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Polyps and cancer in the colon usually grow slowly. Some polyps can turn into cancer over time if not removed early. Healthcare providers recommend that all people age 50 and older get screened for colorectal cancer. Some people may need to be screened earlier because they may be more likely to get colorectal cancer. Screening tests can point out warning signs before you notice that something is wrong. The two tests healthcare providers suggest most often are colonoscopy and the fecal occult blood test, or FOBT. During a colonoscopy, a scope will be used to look at your entire colon. If your healthcare provider finds a polyp or other abnormality, he or she may remove it and send it to a lab to check for cancer. A colonoscopy is usually not painful, but you may experience some discomfort. You will need someone to drive you home after the procedure. For an FOBT, a small sample of stool is placed on a test card. Follow the instructions carefully. For most tests, you will use stool samples from 3 bowel movements on 3 different days. An FOBT can show if there is unseen blood in your stool. Many foods and medicines can affect the results. The results of this test cannot tell you for sure if you have colon cancer or if you do not have it. The results of this test cannot tell you for sure if you have colon cancer or if you do not have it. Thank you for using Explain.